Welcome to TechNOW. I'm your host, John Reid, also CEO of CATA Alliance. And we're very pleased to have with us today Brian Hurley, the President and CEO of Purpleforge. And he's going to be talking about something very close to our heart, which is mobility healthcare to help make our healthcare system more efficient and effective. Brian's going to share some thoughts on how mobility can advance that healthcare equation. He's then going to talk to some of the obstacles that companies or organizations have in adopting a mobile healthcare solution. So Brian, with that background, give us some insights on how mobility applications can help us with Canadian healthcare. I'm interested as a citizen.
Well, certainly. Well, thank you very much for having me here today, John. I always enjoy talking about topics like this, which are near and dear to everyone's heart, I'm sure. It's interesting when we look at mobile apps. Like in 2013, towards the end of it, we're looking at over 80% of people in Canada owning smartphones now. So it's very much becoming one of the most dominant forms of communicating with people. And one of the biggest things that mobile healthcare applications can deliver are accessibility and reach. And this is really anytime, anywhere access to information. And mobile applications can uniquely provide that information in context based on people's preference and location. And what we're seeing, of course, is healthcare costs are an ongoing point of concern for taxpayers and government. And the mobile applications can help reduce costs on both the patient side and the healthcare organization side of the equation. So on the healthcare side, mobile apps can help by helping patients or potential patients guide the appropriate healthcare choice, such as deciding whether they should be going to a clinic or their family doctor or to a more expensive emergency room, for example, and finding those services which are close by and appropriate for their needs. They can also very much help out with supporting chronic condition monitoring and treatment in terms of automating it and making placing the care in the hands of the patient themselves. And relative to the healthcare system itself, it can certainly help by reducing costs for common high-cost items such as hospital readmissions, where there's an opportunity to provide some education as well as provide some directed self-management tools to the actual patient themselves and thereby help reduce their readmission chances. Now, the mobile apps can also help increase the healthcare team's productivities and efficiencies relative to reducing paper and paperwork. It can certainly go a long way, and it has done in some hospitals, like for instance in the Ottawa Civic, streamlining patient care by allowing healthcare professionals to order tests, view test results, and access patient records directly at the patient's bedside in the hospitals. And more so than that, mobile applications, we're seeing more and more staff and patients and physicians and administrators using mobile applications or devices as part of their day-to-day work process. So the mobile applications present the opportunity to provide a streamlining of general communications and workflow between the hospital, their hospital staff, and the physicians as well. And a consequence of aside from saving the costs in general, a consequence of increasing the productivity is going to allow our healthcare system and our healthcare organizations to do more with less cost and to do it faster and to hopefully help improve patient care and reduce wait times, which is important to all of us.
Well, Brian, you make a pretty compelling case. I know that Purpleforge is involved in a number of pilots. I think we're going to be doing an interview with some of the executives at, I believe, the Norfolk Hospital. But I'd like to know, if I'm an organization looking at sort of taking the next leap forward in adopting these new technologies, are there specific obstacles or challenges that I have to look at? Like, what has to be overcome here? How can we accelerate this? And pretend I'm a CEO of an organization that's looking at adopting mobility healthcare. What are my challenges?
Well, it's, John, as we've talked to various healthcare organizations, three main challenges seem to come up consistently. The first one, which is not necessarily a challenge that's just unique to the healthcare, but certainly in the, more acute in the healthcare space, is that of budget. There's always going to be pressure on the healthcare budgets, and the healthcare organization is more often than not going to be very much focused on the today and on maintaining existing service levels rather than spending on the future opportunities and potentials of reducing costs and improving service. The second area of challenge that most healthcare organizations are going to run into is the fact that a lot of the operational infrastructure And this is really goes down to the fact there's a very wide range and a variety of IT systems in hospitals and healthcare organizations, which really limits the ability for healthcare organizations to have 100% reuse or take advantage of perhaps more cost-effective off-the-shelf solutions. And the last challenge, which is something which really boils down, which people can do about it, but requires sort of a commitment and a desire to take the risk and to move ahead to try to advance the yardstick, is out of resources. And specifically, I'm talking about the people with the healthcare domain expertise. This is the expertise that's needed to basically champion and to execute the strategy and these people are typically already heavily overloaded with their existing healthcare responsibilities, and that in and of itself represents perhaps the biggest challenge to health organizations in terms of looking to adopt and introduce mobile application solutions into their organization to take advantage of the future emerging opportunities, cost savings, productivity efficiencies, and employee satisfaction and the like.
Well, Brian, I've asked David Farnes to actually close TechNOW today. David is the leader of CATA's healthcare division, involved in multiple initiatives, and he's really been driving this whole imperative of creating and accelerating the adoption of mobile healthcare applications. So, David, can I have you close TechNOW?
Yes, thank you, John, and thank you, Brian. Very insightful comments, and we want to hear more from you, and hopefully we'll hear more from you on CATAnet TV in the future. And we're going to explore all of the obstacles and all of the enablers and try to find solutions at our Mobile Health Roundtable upcoming in Ottawa on April 29th. Hopefully people will be able to join us. You can find out more on cata.ca/MHAV, that's MHAV. So come on, check us out, and we look forward to continuing with the dialogue. Thank you for TechNOW.